How can we diagnose a PCL tear? MRI or magnetic resonance imaging is a gold standard investigation for diagnosing any kind of a ligament tear, including PCL. So when a patient comes to us, usually in the initial phase, in the acute injury phase, there is swelling and there is a lot of pain. So it's very hard for us to assess the severity of the injury. But with rest, ice and cold packs, when the swelling settles down, when the pain settles down in a week or 10 days, that's when we send the patient for an MRI and get our diagnosis. It is not only for diagnosing PCL, it is also to diagnose other associated injuries which may require earlier attention than even PCL reconstruction.